As an employee of the YMCA, you may be asked from time to time to clean a spill that has the potential for being a biohazard situation. To protect you and those around you, we've implemented a few training steps to ensure your safety. Everything that you'll need to clean up a biohazard spill, whether it be from a blood, from an injury, or whether it be vomit from a child who's thrown up, all the tools that you'll need will be found within a toolkit within your work area. The first tool that you have available to you is a safety cone that'll identify the spill that's on the floor. So simply pull it out of its tube, let it pop open, and set it next to the spill site. Please keep that safety cone in place throughout the cleaning procedure. The first step is to take a disinfectant / deodorant. It's called Virex 256, and you'll identify it by the blue writing on the label. Simply take the Virex spray it over the top and surrounding areas of the spill. That'll begin to knock down some of the odor that may be present, and it'll also start to disinfect. During the first minute that the product is on the spill, it'll break down the AIDS virus. Over the next 9 minutes, it'll break down almost 100 other viruses and bacteria, including hepatitis, staphylococcus, E. coli, that may be present in this cleanup situation. Once that is sprayed, we need to let it dwell for 10 minutes. During this 10 minutes, if you have other people, especially children in the spill site, you'll need to redirect them. The other two things that we'd ask you to do is to make 2 phone calls to the YMCA building staff here. One would be to Steve Fox at 121, and the other phone would be at 133, that's to the maintenance staff. And just let them know who you are, today's date and time, and what room or part of the building that you're in that has a spill, so that they can try to assist you at that point. If you're a teacher in a classroom, the maintenance staff, if it's during the weekday hours, may be available to help you, and they can come into your room and assist you at this point. But if not, allow the product to dwell for the full 10 minutes. While you're waiting, there are a few things you can do, and that is to start prepping for the rest of the cleanup. These are the biohazard bags that we'll be using on each cleanup. Every time there's a cleanup, we'd ask that you have ready 3 separate bags. Simply open a bag and fold the sides over. Once these bags are open, and you'll have gloves on as you do the cleaning, you want to make sure that you have something for your gloves to grasp. So what you'll be doing is you'll be putting the items into the bags and then using your gloves on the outside of the bag versus having to pull them apart again. Another thing that you can grab during this 10 minutes are the little twist ties that go along with the bags. These twist ties we'll be using instead of trying to knot the bags up. Again, just to keep you safe and out of harm's way when it comes to any potential biohazardous situation. Once that 10 minutes has expired, you have a couple of other tools for your benefit. One is a pair of safety glasses. You may or may not choose to use these. That's completely up to your discretion, but they are easy to use. Safety glasses, we have gloves, and we also have a mask. The mask will help protect you from several viruses. It'll also help in the case that there is a strong odor present. The mask is quite easy to use. You're going to use it with, there's a light orange and then a white side. So you'll take the orange side, move that up. It has a little metal rim on the top to secure around your nose. So you'll recognize it by the metal rim. Inside of the mask are 2 bands. So what you can do is you can just take your fingers and thumb and simply separate those. One of the bands goes above your ears, one below, and then just pinch around your nose so you have a nice, secure seal. I'm going to take that off for the rest of the video, just so that you're able to hear me a little bit better. The next step, after the 10 minutes had expired, is to take the second product, which is a Devour product. And what this will do is this will take anything that's liquid and it'll start to solidify it for the sole purpose of just making it an easier cleanup. You can start on the outside of the spill and work your way into the middle. And as I do this, anything that's liquid is quickly turning into a gel and even a solid state. We have gloves in each one of the kits, and you'll notice that there are several pair available in case you get interrupted and need to change out gloves during any time in this process. Once your gloves are on, you can reach in to find a scoop. What we've done is we've just taken paper plates, really simply, just cut those so that you can use one as a pan to scoop into, and then the second one, just kind of work your way and shovel it into the pan. The spill that once was just mainly liquid is now almost like snowflakes. It's dry and it's real easy to scoop and handle. So that's the purpose behind the Devour product, is just making it easier to clean up with. Once that is into the pan, simply put it into your bag. And then the next step is to begin to wipe up any other residue that's around the spill. So once again, take your Virex 256, apply it to the spill. You may even want to apply some to your rag. And then you can use the towel to clean up any remaining residue in the spill. There will be several towels in your bag, and we encourage you, once you've used those, to put those right inside the Biohazard bags. This bag is now completed. You take a twist tie, you tie it off so that nothing spills outside of the bag, and this gets set into a second bag. The next step is to take the Virex 256 and once again spray the affected area just so that it may kill any remaining residue. At this point, the hazard's clean, it's disinfected, and you'll be able to dispose of your items, starting with your gloves. To do that, simply pinch one of your gloves on the outside. Don't put your hand inside the glove because your glove's been contaminated. And begin to pull this back to get the inside of the glove to the outside. And as you've done that, take your thumb or fingers from your other hand, slide it inside the palm of the other glove and begin to peel that back so that you have your hands touching the insides of the gloves and you're not recontaminating your fingers. You now have this bag that can be tied off with a tie. And then these two bags can be put inside the third bag that you set out. And this just provides an extra precaution, an extra layer of protection for all the materials that you've used. Once this is done, you'll want to take this to the biohazard disposal site in the building that you're in. The final step then is to go, after you've disposed of that, is to go and then sanitize and wash your hands properly.